You'll find out how to do 5 different bridge exercises in this video. The bridge exercise is great for targeting a few different things with the one exercise. Glutes in particular, so the back of the hips. It will also target the pelvic stability, the low back and the hamstrings. Knowing a few different variations of the bridge can really help with the variety of your exercise routine. My name's Claire, I'm a physiotherapist from PhysioFit Health. Subscribe to our YouTube channel and you'll keep updated for when we publish our videos. Here are your 5 bridge variations to try. The first one, this is your basic bridge. And it can actually be fitted into 2 different subcategories. So the basic bridge first variation is an articulated bridge. Your start position is where you're laying down flat on the mat, your knees are bent, your feet are on the mat, and you've got an imaginary bit of Velcro that is down the spine. So that bit of Velcro is now stuck to the mat that you are on. You're thinking about engaging your glutes, so you're squeezing your glutes together, tuck the tailbone underneath, and you're going to lift your hips all the way up. You're going to stop when you feel the pressure in and around the shoulder blades, and then you're going to lower yourself back down in reverse. So you're trying to put the upper back down onto the mat before you then put the lower part of the spine back down. Try this a few times. It's a little bit of a work in progress if you haven't done this. It's aiming to really work on the flexibility of the spine as you're trying to raise yourself up and then lower yourself back down again. Keep an eye on your knees. You've got imaginary drinks on your knees. You don't want to spill them. It just helps to keep these legs still whilst you're working around the glutes, pelvis and the spine. The second variation for your basic bridge is where you start in the same position, start in that rest position. Your back's down flat, your knees are bent, feet are flat on the floor. You're just thinking about these hips as a hinge. You're thinking about squeezing your glutes together and then you're going to lift these hips all the way up and then all the way back down again. Whilst you're doing these 2 variations, I'd suggest getting that brain thinking about where you're feeling any activation. Are you feeling it more around the glutes, the back of the hip, or are you feeling it more in your hamstrings, which are the back of your thighs? If you want to bias the glutes a little bit more, you're going to walk your feet in closer towards your body and repeat. If you want to get your hamstrings, then you're going to walk your legs, your feet further away from the body and do the same movements. Try out both, feet close to you, feet further away, just to see where you're feeling the majority of work. Your second bridge to try. This one brings in a little bit of hip rotation. You're gonna start in your rest position, back's down flat, knees are bent, feet are flat, and you're gonna raise yourself up into your bridge position. This one, you're gonna draw attention to your right knee. You're going to place an imaginary drink on that knee that you don't want to spill. And then your left one starts facing up towards the ceiling. You're going to breathe out as you float that knee out to the side and then bring that knee back to the start position. Breathing out as the knee goes away from the body, you're breathing in as it returns. If you want the visual imagery, you are in a narrow corridor. So with that left knee, you're going to float the knee out to the side. You're going to touch the side of the walls of that corridor, and then you're breathing in as it returns up. Repeat on both sides. And whilst you're doing this movement, you are checking that your hips are staying nice and level, that you're not dipping one or the other. And the knee that isn't moving stays really still. Once you've done your repetitions on each side, then you can obviously lower yourself down and move on to something else. Your third option for the bridge. This one you can use a band, a stretchy resistance band. I would suggest using a blue one as it's fairly strong, or even a grey one and that is stronger still. Depends how much of a workout you want, to be honest. You are going to start by bringing your knees together, knees and feet together. You're going to loop the band just above your knees, tie it in a double knot, make sure it's really tight so that it doesn't ping. And then you're going to get yourself set up in your start position for the bridge. You're laying down flat, your knees are bent, your feet are flat. You're wanting your legs about hip width apart with this one. Now, with the band looped around your knees, you might find the tension in the band will bring these knees together to a certain extent. You're going to fight against that and try and bring these knees so that they at least point up towards the ceiling, if not ever so slightly, even further pointing out to the side. You're keeping these knees in that position as you are raising yourself up into your bridge and then lowering yourself back down again. The reason you're putting the band around your knees with this exercise is it will just increase the work of the muscles on the side of the hip, because throughout the whole of the exercise you're fighting against the band. These knees are coming out nice and wide. That's where it targets the muscles at the side of the hips and the pelvis. The fourth exercise for you to try, again you can use a band for this. And again, I'd suggest one of the stronger ones. These muscles are quite large, they're power muscles, so you really want to get them nice and strong. Set yourself up for this one in your start position, so you're laying down flat on the mat, your knees are bent, feet are flat. With the band, you are now going to get that looped over the hips and the pelvis, and you're going to anchor it with both hands either side. Once you've done that, then you can lift your hips up into your bridge and then you can lower yourself down again. The reason that you're getting the band over the hips and the pelvis is it just increases the challenge for you, lifting the hips up, and it will make the muscles work just a little bit harder. Your fifth exercise to try out is one that is quite challenging to do, but it's worthwhile giving it a go just to see if you're able to. You're in your start position, so you're laying down on the mat, knees are bent, feet are flat. You're going to lift your hips up into your bridge position, really thinking about engaging the glutes, and you're going to take more weight onto your right leg, and then you're going to peel that left one off and you're going to straighten that left leg, and then you're going to pop that left one down, keep your hips raised, and then you are going to straighten your right leg. Bend your right knee, put your foot down flat, and then you can lower yourself all the way back down again. Something to watch out for when you do this exercise. You've got your hips raised. You're really wanting these hips to be nice and level. There's a tendency, or there's a potential, that if you lift your left leg, then you might dip down on that left side. Or you might find that the right and the left side of the pelvis, they're not as level as they were. Really fight against that. You're wanting them to be as level as you can do whilst you're lifting one of the legs up. Those are your 5 suggestions of bridge exercises to try out. Some are harder than others. You're always wanting that quality of movement. I'd certainly suggest checking them all out just to see if you can or you can't do them. Perhaps you can try a different bridge exercise a day, or alternatively choose a week. You can do the same bridge exercise that week and then you can change it in the following week. Subscribe to our channel and we'll see you soon.